I'm Dr. Stephanie McNally. I am the Director for OB-GYN Services at the Katz Institute for Women's Health at Northwell Health. I'm also the Vice President for the OB-GYN service line and for ambulatory operations at Northwell in the Central Region. When we're talking about the leading cause of complications for women's health, particularly in pregnancy, it is related to cardiovascular disease, and prevention is key. When a woman goes in to see her OB-GYN, when they go in to see their internist, really talking about those underlying family history risks, what happened in a prior pregnancy, is vital. And that's where we start. We start with conversations with the providers. After that, for women that have been identified as having those risks, then we really need to coordinate their care moving forward. What we do in the cardio-obstetric world is look at women with risk factors, identify them ideally preconception, work with them during their pregnancy, and then a really key element for women's health is that postpartum period. What do I mean by that? Pregnancy is one isolated time in their life, but that then sets them up for risk factors later in life. Women with preeclampsia, and there's a difference between gestational hypertension and preeclampsia, have a lifetime risk of developing cardiovascular disease, 4 to 2 time increase depending on if you're looking at heart failure versus cardiovascular disease versus looking at stroke risk. But at Northwell here, what we do is we then loop our patients that have had a complication in pregnancy and then have them follow with long-term care with one of our trained cardiologists. And those are the time periods in your 20s, 30s, before you hit different stages of your life, that prevention key is what we here at Northwell and the Katz Institute do differently. There are several factors of why we're seeing an increase in high blood pressure, particularly in pregnancy. And to really separate it, when we're looking at hypertension in pregnancy, we want to identify those women that have had chronic hypertension, meaning that you've had it before you were pregnant. Then you have gestational hypertension, which is a woman that will develop high blood pressure in pregnancy, but are not having severe features, meaning headaches, liver function changes. And then preeclampsia, which is a separate but higher risk condition in pregnancy. And what we're doing is realizing that because women are having children later in life, if you're older, if you have underlying risks of obesity, diabetes, multiple, so twins and triplets, all of these factors really do increase your risk for high blood pressure, particularly in pregnancy. So as all of those factors have changed since the 90s, women are going to be at higher risk just because of how they're living and when they're having their children, if they choose to have them. Black women have the greatest health risk when pregnant because of access and systemic racism. When you're looking at socioeconomic access, insurance, there's implicit bias. So all of these pieces really are affecting women's health, particularly for Black women. So making sure every woman gets access to equal care is vital. And for certain women of certain backgrounds, based on family history, based on their underlying risk, that also then increases women's risk in pregnancy, before and after. So all of these pieces together put women at certain risk factors, and we as a healthcare system need to understand and make sure we treat all women equally and create that access. When we're talking about obesity and pregnancy, as many of you are aware, there is an obesity crisis in the United States. And when we talk about obesity, we're focused on body mass index, and that relates to a woman's weight in relation to her height. Obesity is a factor in pregnancy, particularly because it does increase risk factors. You're increasing your risk factor for high blood pressure. And as we know, there's different types of high blood pressure in and out of pregnancy, whether it's specific to gestation, chronic, or preeclampsia. Women who are obese in pregnancy are at risk for diabetes. They're actually at risk for pregnancy complications that relate to the fetus, miscarriages, complications later in pregnancy. And women that do have a higher body mass index have a higher rate of C-section. And we know that C-section does have other long-term complications for first pregnancy, second pregnancy. So overall, what we do differently at Northwell is that preconception evaluation. Where are you starting with your healthcare risk? Do you have underlying high blood pressure, risks for diabetes, risks for obesity, and how do we then key you into health changes preconception? Because we know there can be complications in pregnancy and then long-term complications. I get a lot of times, Dr. McNally, I do not want to be a geriatric pregnancy. What does that mean? So I dislike strongly that word geriatric. For women that are over 35, let's talk about advanced maternal age and try not to use that geriatric pregnancy terminology. But we do know there are complications for women who are older when they have children. There are a multitude of complications that can happen in pregnancy when you're over 35. Particularly one that stands out is egg quality, quantity, and chromosomal complications. So for women that are older, it may take you longer to get pregnant. The quality and quantity of your eggs may be less. And if they're not as good a quality, it may not lead to a healthy full-term pregnancy. And that's that relation with the genetic complications. One of the most commonly talked about is Down syndrome. So again, higher rates the older you are when you do conceive, if you choose to conceive. When you are older, you have a higher tendency to develop high blood pressure in pregnancy, diabetes, and then that leads potentially to other complications to mom and baby. What are those complications? You can have an earlier delivery if you're having higher blood pressure. You can have an earlier delivery because of preterm labor, which can occur as women are having pregnancies later and children later in life. We're talking a lot about healthcare and advocacy, which are important. But if you're not connected with your provider, it really is at a point where your healthcare can be at a standstill. What do I mean by that? If you have faith in your provider, you have faith in the team that you're working with, that dialogue really is present. It's not a monologue. We talk a lot about relationship-centered communication, and that's another thing that Northwell does really well. We are about open-ended questions, and if your provider is asking you, what do you need? How do you feel? And not giving you that yes/no, that creates a really deep trust with your provider and your healthcare team. That is so important because if you're heard and your words are truly appreciated, that creates that trust and your healthcare outcomes will be impacted in a very positive way because somebody's listening to what you feel, what you need, and that's that dialogue that is vital for your healthcare outcome. When you're pregnant, particularly if it's your first pregnancy, it can be a very uncertain time, a lot of the unknown. If you have questions about what's unknown, you have to ask it. And that's where Northwell does a really good job by listening. So if you're concerned and you bring up that dialogue with your provider, you really want to make sure you advocate for your questions because that lets your doctor and your team know what you need and what's concerning you. Much of your healthcare really has to be driven to what's on your mind. And so by advocating and speaking openly for what you need, that will really impact your health care, not only for you, but for your baby. A really important thing that Northwell does very well is mental health. And for women, if you're struggling, if you don't feel that not only your physicality, but your mental health is not going well, that will have long-term outcomes for you and your family. So again, bringing up those concerns, talking about your health, and really advocating for what you need. And to that point, if you don't feel that you're being heard and that someone's not listening to your words, you really need to find a doctor or a provider that will do that. Things are always evolving, always advancing. And I think one of the most important pieces of that innovation is that tech communication with patients. Just reminding them, when you're at your doctor, talk about what happened during your pregnancy. And we have ways to chat with patients, use email reminders that that's part of your heart health risks. So if we can empower patients to put it in their notes and bring it up, that's one of the most innovative ways that we can collaborate with patients. Just tell them what happened in the pregnancy, tell them what you need, and bring up your family history. It's not just about your visit, it's about what led you to that visit with that cardiologist or your primary care doctor. One of the most vital things that we can do when it comes to collaboration with the American Heart Association, with Northwell Health, with your obstetrical and GYN providers is preconception discussions. What are your underlying risks? What should you be prepared for? So that way you're maximizing your health, cardiovascular, obesity, diabetes, and any underlying risk before you're pregnant. And while you're pregnant, as your healthcare evolves, making sure you dialogue and communicate. What Northwell does in an incredible way is communication with patients and making sure we integrate your health with the providers that we have that are trained and skilled to care for women in, during, and after their pregnancies.